Good evening, everyone, and thank you for joining us tonight. My name is Devin Williams, and I'd like to welcome you all to the OAAA Data Hub Community Forum. The goal of today is to create a space to have a conversation about the relaunch and the revamping of the OAAA Data Hub. Today's event will be in two segments. We'll start off with one of our panelists giving information about navigating the OAAA Data Hub, which will segue into a Q&A with the other panelists. I'd first like to start off by introducing our panelists and giving them an opportunity to give a little bit of background information and credentials in regards to data. And so I'd like to start off with Cynthia Jacobs.
Hi, Devin. Thank you. Hello, everyone. Good evening. Thanks for joining us. So I'm Cynthia Jacobs, and I'm working with the Office of African American Affairs to redesign and relaunch the Data Hub on its website. And the goal of this project essentially is to not only, I think, pull in a lot more data about African Americans specifically and make it accessible to the public and our community especially, but to also make this project a collaborative one where we get feedback from you guys and we're able to refine and continue to make the Data Hub more robust and more comprehensive. So what we have available today on the website is essentially in a beta format. So it doesn't have all the, bells and whistles just yet, but it gives you an idea of where we're trying to go with it and some of the types of tools that are available and just the types of information that can be available within the hub. So I will actually be doing a little demo through a couple of them, just giving you guys an idea of what it looks like. And it's on the website. So you can also log onto the website and check it out yourself and play around with it and explore it. Reach out to us with any questions you have or anything like that. And in terms of my background, I actually got into data mapping and visualization through working with an organization in New Mexico called the New Mexico Community Data Collaborative. So that's actually where I got my training. So I'm by no means an expert, but I have some knowledge of how to create maps, how to access data, how to build data sets, and I'm using that to help our community and also to, I guess, be a person who can help to try to make the information feel a little bit more accessible, because I think sometimes it can be pretty intimidating. It definitely was when I first saw it and I just didn't know what was happening. But over time, as I got more training, I got more comfortable, and now I'm kind of able to train other people. So I've done a few trainings too. And so in working with OAAA on this project, I really want to just bring all those skills to bear to help bring the Data Hub, I think, to the robust resource and tool that is actually going to be. So thank you guys for being here.
Yes, and thank you, Cynthia, for that wonderful introduction. I can attest to the training that she's given in regards to data. We've had multiple long sessions, and she's very, very well versed in data, and so I really appreciate you and all the training that you've given me. Next, I'd like to introduce our other panelist and give him an opportunity to introduce himself. And so, Jay, can you come up to the floor?
Well, good evening and hello. My name is Jay Blackwell, and I am a community member here in Albuquerque, New Mexico. I represent basically two agencies. One is a behavioral agency called Umoja Behavioral Health. And we approach our work from an Afrocentric and feminist viewpoint to support our clients in their highest or optimal being. And the other agency that I'm here representing is called INMA, and we are the New Mexico African American Tobacco Prevention Network. So both of these agencies are really dependent on and use data in our day-to-day activities. And we use it in a way that is used to kind of reinforce not only what we know happens on a personal level, because data is with us all the time. We just take it for granted. And then we can also use it on a professional level. And as someone who has been very loud in the community about saying, where are these community profiles? How come we don't have better data around here? When I heard that this data hub was being created, I was truly thrilled, because I know what this can mean for a family, for an individual, as well as for our professional field to make changes in health. So I'm excited, Cynthia and Devin. So thank you.
Wonderful.
And to the office, this is really great.
Thank you.
Yes, thank you. We really appreciate you being here, and I definitely look forward to getting a little bit more of your perspective on data, and just getting a little bit more insight on how you feel about the Data Hub. And so thank you again for being here. We really appreciate it. And just before we get started, I just want to remind everyone that if you have any questions for the panelists, please put them in the Q&A, and we'll work to get your questions answered. Now, I'd like to turn it over to Cynthia as she gives us a rundown of the OAAA Data Hub and how to navigate it.
Okay, thanks, Devin. Sounds good. So I am going to share my screen, and we're gonna just take a little preview of the Data Hub through OAAA's website. So hopefully everyone can see the screen, and you can see OAAA's website here. And so there's a Data Hub tab, and then each of these tabs here are each pages for each one of the dashboards. And so the cool thing about this is that you can actually click on the word Data Hub, and so it'll take you to the landing page. So we will let that pop up. All right, and so from here, and you know, this page is also in beta as well. So we will be adding more kind of contextual information, like more info around each one of the dashboards, you know, a short summary as to what it's about. But from here, you can access each one through the icons or the labels here. And so let's take a look at the first one. And I'm just going to go through each one just to kind of give you guys an idea of what it looks like. And so it populates. Oh yeah, and that was me scrolling. So as you can see, as I just did, when you're on the map and you have your cursor over this map, it's interactive. And so I use my scroll wheel so I can scroll in and out. And you can also see these numbers change over here, and you can see the charts change a little bit as well. So as you zoom in or you click on an area, things can adjust if it's appropriate. So in clicking on the different areas, in this map, I do believe it's based on small areas. So we don't have to go into exactly what that means, but it's just kind of a way to have sort of geographic boundaries around information, like within a particular space. So there are different ways that those are set up. So most people maybe have heard about census tracts because of this census, which is kind of a larger area that's covered. And then we try to, at least at NMCDC, create the databases based on small areas, which is more of a little bit more granular, and it's more to the neighborhood size. So you kind of pack a little bit more info in there.
Is that like zip codes, or is that different from zip codes?
That's a really good question. I think it's probably a little bit different from zip codes. And so we do have, like there are maps on NMCDC that actually can map out and show you where the zip codes are. And they appear to have their own kind of boundary to them. So that's like information that you could overlay on one of these maps to look at, okay, where am I in this particular zip code? And then look at some of the information that way as well.
So NMCDC stands for the New Mexico Community Data Hub. Data collaborative.
Yes. Mm-hmm. Yeah.
Okay. All right.
And so through
Double
that
checking.
organization, yeah, yes. And through that organization, so I created some maps. One of my colleagues there, she created one of the dashboards as well. So we'll be looking at hers, and she has some like interesting tools on hers that that are different from mine. And so the thing that I love about this is that we've each kind of done something different to just show what some of the options are in terms of how to visualize the information, you know, and how to make it accessible to individuals. And so, and yeah, like when you click on any one of these areas, you see a pop-up window. And so we actually complete these by hand, like manually we type in. So not the numbers, because they come from the data sets, but we go into all the codes and we type out what they mean. So that way you don't see, you know, DEEF 1 2, and then you're like, what is that? You know, and then some folks haven't done that, but that's a practice that we try to implement, just so that you, as a, you know, a person in the community, you can open this up and you can say, oh, okay, rate per 100,000 of chronic disease deaths, Asian or Pacific Islander, right? So you know then what you're looking at. And some of them have like different other pieces of information, just the way in which they kind of scroll through. So, and it's a lot of these details that really are going to get a little bit more refined in the background. So some of what we see may not necessarily stay, except for like the pop-ups, but you know, the pop-ups will probably get a little bit more refined, and there are ways to add other pieces of information in the pop-ups. So it's really just kind of a matter of seeing what works.
So the pop-ups follow your arrow, wherever your arrow is, a pop-up happens.
Once you click on an area with your mouse, then the pop-up pops up. And then it gives you like a little bit more detail into that area. And
yeah, I wasn't sure if it was on the map or if it was on one of these blocks of number things.
Oh, okay. Right. Yeah. So, and those in the middle are just indicators that through this dashboard application, you can actually specify pieces of data to just highlight and show that information. And then, you know, label it as appropriate. And, you know, we have a way to actually have some of that information will shift and change, like as you scroll in by the extent. And so you can kind of see those moving around a little bit. Or, you know, you click on a place and then it may or may not change, but definitely when you scroll in, then those numbers will adjust. So we're looking to have that as a function on all the dashboards for I guess, more accuracy in that respect. And let's see, and so, and within the map area, so we have this little stack, what looks like a stack of papers, this little icon over here. So these are all the layers, right? So these are all basically the pieces of data that make up this map here, right? That we're seeing. So now we're not looking at all of them at once, but I can check off one like I did here. So I unchecked chronic disease deaths. Now I can check cardiovascular disease deaths. And so that one pops up. And so these are tools that anyone can access. So this is open, you know, you don't have to have any special logins or anything. And you can look at the information that you're interested in seeing and you can explore it. You can click on it. You can scroll further into it and like kind of get down into an area and see what's going on, you know, and then the map.
Oh, wow.
You
can go down to the street level.
You can go down to the street level, yes.
Although when you get to the street, it'll put you into an area. So depending on whatever that area is what the data is going to reflect, correct?
Yeah, and it does depend on, I think, what information is kind of showing through, right? And so like we saw when we get to a certain point here, this is just an extent kind of thing where that polygon, the color goes away. And so that's something where we can make it to where it can go all the way down to neighborhood. It's just it's a viewing thing, really.
Yeah. So this is really good for businesses, or even for like I'm in healthcare, so it's really good for healthcare as well because we're focused on chronic disease rates here. But depending on like my interest as either an entrepreneur or as a professional, I can see where this type of granular data would be really good. For instance, if there are grocery stores in these designated areas, what kinds of foods are in those grocery stores? Are there grocery stores there? Is this an opportunity? And if I'm selling fresh fruits and vegetables, like I know everyone here eats on the regular basis, then I can know where I could target my stand to put some of that. Is that correct?
Some of that information is actually available, and I'm actually glad you brought that up because what we're setting up now is really just kind of a high level sort of general view into like some health aspects impacting our communities. And actually let me click from here and go into the legend. So like this right here tells you what the polygons mean, you know, that we're looking at here. And so we can see that like in the darker areas, the darkest areas, the rates per 100,000 persons of cerebrovascular disease, which is basically strokes, disease, those stroke deaths, we can see the rates here. So there are actually labels on each of these areas to show you, you know, what that rate is for that area for African Americans, right? And so this just gives you a guide into, okay, so how many really dark areas do we have, right? You know, and where are some of the lighter areas, you know? And it also gives us an idea too of intuitively maybe or not, depending on how you view information, it can kind of give you an idea too of where African Americans are. Yes. You know, without having to specifically look at population, but it gives you a sense, right? And so in terms of going back to the grocery store, fresh food question, I know that there are some layers that are available for that. And that was one of the other things too, that we wanted to put out into the community and conversations that we've had ourselves as a team in terms of community assets. So I see that information, right, as kind of being overlaid with, okay, yes, we might have really high rates of, you know, cerebrovascular disease in this particular area, right? But then when you add, say, the grocery store layer, or you add other types of layers to a map like this, then you can say, oh, maybe it is because there aren't enough fresh grocery stores, you know, or maybe it's because they are very far out of town, you know. So it's a way where you can actually look at some of the geographic factors around what's possibly impacting that particular outcome. And so
excellent. Yeah, that's exactly what I know that I have been looking for as a healthcare professional. I've wanted to be able to go to a tool that I can say, I'm looking for information around high blood pressure, around stroke, around, is this an issue in Santa Fe? Is this an issue for Black communities in Hobbs? Is this an issue for, as I hear it called so colloquially, the war zone? Is, you know, like, what are some of the impacts of sirens, of bad health, air, or bad air, or questionable air, or, like, you know, questionable concerns that occur in this area? And what can I, as a concerned citizen or a neighbor, frankly, who lives here, what do I need to be aware of? And what opportunities are there for me to become involved to make my community even better? This is why
Yes.
I like
Yes.
this information.
Yeah, excellent. And that's, and the things that you're mentioning. So I believe that there are data layers available that can be added to these maps to indicate like rates of asthma, and sometimes depending on how the data has been like processed, so to speak. So sometimes it's age adjusted, where it may not be broken out by race, but you can see it by age, because it actually, and in the work that I've done, it was more focused on actually creating these data sets to disaggregate the races, even though we're still just like at an aggregate level of that in terms of the 5 major races, but it's a starting point. And
It's a
so
starting point.
and when we start to look at things like, okay, maybe there might be information about where the bus depots are, things that would affect asthma hospitalizations, air quality, where some of the facilities and things are. Those are things that can be mappable. And so this is why I love getting community feedback, because things that people think about and they feel are important, that gives me, kind of like a punch list to say, okay, I'm gonna go and check it out and see if we already have that, right? And if we do,
Sure.
I can add it here. And then if not, then it's like, okay, let's start kind of moving this toward figuring out how to collect that data and add it here ourselves, and continue to make these tools like living, breathing instruments that we use to, create change in our communities and make things better.
Well, okay, now look, I will have you go through the chronic disease all night long because, this is what I do.
And this is my favorite.
Keep it moving. Yeah, I know,
Yes.
but please share the wealth. There is more. I know there's more.
There is more. Yes, I know, because with the chronic disease, this is the one that I actually have created from start to finish. So I actually downloaded the data sets, processed them, and created the maps for them. So I'm intimately familiar with them. But yes, let's give some of the others some shine as well. So we'll go back up and we'll go to the economic indicators. And this is the one. Yes, the money.
We can follow the money.
Yes. And so my colleague Emily at NMCDC, she created this one, and I'll do my best to kind of go through it a little bit, but she's highlighting here, median annual household income for African Americans, and then so both of these are indicators, and so she's using this comparison towards median household income total population, which, we've talked about this before. Sometimes how things are labeled can affect how one may understand the information. And so this is the kind of stuff we want to hear about too, because if something's kind of hard to understand or it's not clear, it's always good to go back and look at the language that's being used or how things are being described, so that we can make sure that we're making the playing field level for everyone to really access and understand the information, because that's a part of the access too. So not just the technology, but also understanding. So this is one of those ones,
Now, talking about understanding. Okay, so now I see median annual household income. I see African Americans. I see it's a little bit higher than the median household income. My questions automatically are, well, how many are in your household? And then like, what's the cost of living index here? It's like, because it's going to be different in Albuquerque than it's going to be in Las Cruces, right? I think.
Yeah, I would imagine.
So this tool is able to, like right now, I think it's where the arrows pointed, right? On your side, or can it get me down to Las Cruces and tell me more about African Americans and Black people in Las Cruces, what they're making?
So here, the information that she has in this particular pop-up right now, so is we're looking at the African American population as overlaid with the unemployment rate. So this is a question of adding like additional layers to this map to right.
It's
to
never
provide,
easy, is it? It's never just toast on jam. But okay, go ahead. Go ahead.
Yeah. Yeah. So, and that's the thing too. So we wanted to get them built out to give people an opportunity to see, okay, this is the kind of information that you can access, and we're working to refine it and add more information to provide greater context, as you're indicating, around, you know, stats like median annual household income. So if available, and we can break out what the household sizes are and that sort of thing, then those are additional pieces of information that we can add. And we can also, and also too, from a visual standpoint, right? So we don't want them to be too crowded, but say, for example, maybe that's information that might go in the pop-up.
Yeah. Let me tell you why, because it's like, this is really what I see in front of me is like really good information, like right off the bat. Again, I'm coming to this from a professional use as opposed to somebody who's just like looking to see what's happening. Right. So when I look at this, I say, okay, so most people earn 54,813 in their household, and I can compare myself to that. But then I'm not sure if that's across the state or what. So I'm looking forward to them building out this a little bit more so we can see more of the layers. Or am I'm just talking too soon and wanting too much too fast? I don't know. That's never happened before.
I think we all want so much very quickly. And so, you know, because we're hungry, right? So like we're
yes.
We're like,
this stuff doesn't exist in a lot of places. I know, I've looked for it.
Yeah. And so definitely, absolutely, that's like very valid. And I think, yeah, over time, as we're able to get more great feedback from our community, it definitely gives us a chance to add in more information and to layer it a little bit more. And so that, yeah, people will be able to access more types of information too, right? To be able to make comparisons. And from a visual standpoint, then it's like we can go back and reassess, okay, so then what are maybe some other components, you know, that might be a little bit more, like when you're viewing the dashboard as it is, what might pop out a little bit more, what may show a little bit more intersectionality in terms of how you're comparing or putting pieces of data together. So even with like some of the bar charts, like here, for example, we have median household income by race, and so see all the races broken out. And in some cases, we are able to capture 2 or more races, which I do want to state doesn't always include, say, African American and another race, but you know, that's another conversation, as well as other and like total population. So we get to see what this looks like amongst all the races in terms of median household income and where folks generally are, right? So we're kind of looking at the median.
What's that missing category?
So this is Hawaiian and Pacific Islander.
Oh, okay. Okay, thank you. I just couldn't read it.
Yeah. And so this kind of just helps in terms of comparison. And then sometimes you want to isolate some comparisons, you know, so it really is going to be interesting being able to kind of go through over time with getting feedback and hearing how people feel or what they want to see, and thinking more about, okay, how can we best show the highlights, I should say, of some of that information. And there was a point that I wanted to go back to that you made. It's escaping me right now, but maybe it'll come back to me.
Trust me, I'll say something.
Yes, it'll come back. And so, so this is one of the maps. And if you guys can look down here where my mouse is, so this one that we're looking at here is unemployment and African American population, which is this rubric that you see here. And then next to it, we have educational attainment and median household income. So what Emily did here was she used another application inside of this application, which is like a slider map. And so basically what a slider map does, it helps you to see like two maps basically over top of each other, but you slide over and then the information changes. And so then you can see the other. So here in the legend, we see the two pieces that we're looking at are percent African Americans with a bachelor's degree or higher, right, as of 2019, and then African American median household income. So people may or may not know, but there have been studies and research done around the correlation between education and income, right? So that's sort of an example of how we can look at sort of intersectional and correlated pieces of data to say, okay, what are the relationships here? What are we looking at, right? Or how does our level of education potentially affect our income? You know, because nothing is always absolute. So here we can see, so as I'm moving the map over, and when you see the colors on the legend to the left, you can see the difference in colors, right? So the spyglass tool here shows us, let me see, let me get a little closer to it. So we can see the information a little bit more clearly. So let me get it adjusted. And so you see here how it changes. Yeah. So it's like we're kind of looking at, so in the areas of green where we have African Americans with bachelor degrees or higher, right, that we see here, when we pull the spyglass over, those same areas change to show us what the median household income is, right?
It increases.
Yes, with the increased level of education. So when we look at a darker area, let's say like these, for example, right? So we're looking at them here, 40 to 76% of the population of African Americans in this area have more than a bachelor's degree, or at least a bachelor's degree. So when we pull the spyglass over, we can see correspondingly that they're in the upper range of income. So this is
now
the
what's
kind of information, you know.
That's $100 to $250,000.
Yes.
Is that what I'm seeing?
Mm-hmm. Yes.
Oh.
So the dark areas, yeah. Which probably lends to why maybe median income is at least at 54,000 on
right.
average.
And this,
you know,
and this is also
average,
combined household incomes.
Yeah.
Because it's correct.
I do believe so.
Combined.
Yeah, household income.
Yeah, housing, because it's how. Yeah. Oh well. All right.
Yeah. So this is a cool way to add just another dimension to how data can be viewed and things in comparison, so that we can look at relationships a little bit more deeply, right? And so this is something, yeah, that can be added where we see maybe we want to look at that a little bit more closely or show those relationships in other ways. So
yeah, I think with more community interaction, we could really like put some retail stuff up in here as well to see where people live and what retail opportunities, how we spend our money, and where we spend our money is available to us. This is really wonderful.
Thank you. Yeah, so it's a starting point, right? So it's a starting point to not only show us what can be possible, right, in terms of the technology and the type of applications that are out there, but a starting point in conversation around, okay, well, now that we're focused on us, what do we want to see? What do we want to know? What do we want to find out? And also, I think the other aspect of that too is, asking that question of what does everyone feel comfortable sharing, right? Because we have had conversations, and these are probably conversations that are happening a lot around beginning to disaggregate the data amongst our community specifically and what that may look like, right? Because we have all types of nuances and, you know, various needs within our community itself, and so many different people who comprise Black or African American identities. So
correct. We are not a monoculture. We are not a mono people. You know, although categorically we are defined similarly. You know, our data tells us that we spend our money in different ways. We live in different places, and we also have different types of loans available to us that other communities do and don't have. What else you got to show? I'm right here.
You know what? I just remembered the question that you asked. So you had asked about the median household income, total population, and if it was for the state of New Mexico. So as far as I can tell you, whenever we pull the data, it's always for the entire state of New Mexico, and we cover all of the counties. So unless the data is pulled differently for some reason, that's a good general assumption to go with, that it's statewide. And that's our goal as well, to show information about our communities throughout the state. Yes.
Right.
So thank you for asking that. And let's go to education. So yeah, so there are just tons of additional pieces of information to add and just layer onto these dashboards. And so it's going to be exciting to start to bring
it's like, you know,
together.
what I, really, enjoy is that I know this can be used at junior high level, the high school level, college level. It can be used in churches to like talk about who we are, where we are, what we do, and how that impacts our health and life. It can be used by organizations. It can be used by schools. It can be used by teachers. Please, I'm holding up your story. Show me how more of this stuff can be used.
Yeah, no, fantastic. And I love that, you're like mentioning that and talking about the different ways that we actually can utilize this data on an individual level, right? As a group, as an organization, and that's a great point to bring out, that it doesn't, you don't have to be tied to a specific organization or a cause or anything. You can just be a person who's curious and who just wants to know, well, what's going on here? What's up with that? And this is going to become a place where you can go and hopefully be able to find that information. Or if the information you're looking for is not here, it's partner with us to help us create that information, right? So
I think that's very important.
Move forward.
Yeah, because it's like, like you've been saying, this is a starting point. And a tool like this can only get better once more and more people know that it's there and are willing to use it, share what they know.
Absolutely. And honestly, my vision of it is that at some point, if, with the training that we're going to introduce, and we'll speak to that a little bit later, but hopefully some folks will feel inspired and feel empowered to create data sets of their own. And we can look to, integrate those as well, because I think that that's important. This information is about us and it's for us. And it's also, it can be from us, and that to me is the hugest thing that will make this a living, breathing thing. Okay, so this one is still, still pretty basic in terms of the information that's here, but we just kind of quickly highlighted just some percentages. And I mean, we have population here, which that will probably go away, but since we're talking about education, but with high school graduation rates, the percentages of the African American community that's 25 years or older, that has less than a high school diploma, and then the percentage of the African American community that's 25 years or older with a bachelor degree or higher, right? And so I want to say too that the other thing about this is that I know sometimes, depending on how data is sort of presented, could maybe sometimes be triggering for people, you know, depending on how things are set up and how they're worded and that kind of thing, or, you know, elicit some feelings around what they're seeing.
Well, I mean, questions, right? Because I mean, when I look at this data, it says that, let me see, what's 14 and 23? That's 37, 38%. So this is that 38% of the Black community has been to high school. What happened to the other, 62% of people?
Well, these are indicators where I just pulled out just like kind of pinpointing or highlighting specific pieces of information. So basically the way you're seeing it here, it's not really say as a comparative picture of saying comparing this to like, so let's say for example, this could be shifted to say like 14.8% of the African American community that's 25 years or older has less than a high school diploma, right? And then we could look at another number comparatively that maybe shows what the percentage of the total population is of African Americans, or the percentage of everyone who actually has a high school diploma. So this education data has different pieces to it. So let me see, we can take a look at what the layers are. So at least on the map, so with the indicators, like I said, these are specific things that are selected to be highlighted. And then when you actually go into the map, then that's when someone who's exploring the map and the dashboard can actually
I forget about those layers. I forget to always go back to the layers. This is not a static map. This map is meant to be interactive. We have to remember to go back and see what other information can be presented. Very good, very good. Okay.
And that also is too why, we will be conducting trainings, right? To help people get familiar.
Excellent.
And to get comfortable and allow people the opportunity to actually explore these themselves, right? And play around in them. And that's going to generate questions that they're going to have like, well, wait, how do I do this? Or, where is this? And that's going to help people learn how to use and navigate the tool too. So definitely looking forward to people playing around in it, and seeing what they can find. And so, so the layers provide a whole host of information. And again, coming back to like more community conversation means more refinement, right? So then we can add more layers here. Or if there's some that we're like, okay, maybe we don't need these in particular, but let's bring in some new layers. And then, and you can actually choose these yourself.
Well, what about new data? Because we know that with COVID, everything is different. So this is like 2019 data, which is really, good to have. It takes about 2 years for new good data, robust data to come out. But so when do you think new data sets are really going to be reflective of what's happening?
Of COVID, probably, and this is just my, best guess estimate, maybe 2022, maybe 2023, depending on many factors, which can also include the organization or entity that actually collects the data. So when we talk about like federal sources, when we talk about state sources, different organizations or different entities, say like APS, Albuquerque Public School, everyone has or can have like a different cadence as to when they actually publish their data. And so it can vary.
That's actually music to my ears. As a programmer, as resource development, that means this is the opportunity to tell your funders, we have a data source, We have some numbers that we're not sure are relevant to today's society. And we
Yes.
really want to find a way about how we can, better quantify and qualify success.
Yes.
This is great. Like knowing that we have about 2 more years to work off of these as a community really gives us an opportunity to set some goals. So I'm very happy, very happy.
Yeah, me too. And I will add this one caveat though, that having 2019 data is sometimes a best case scenario, right?
Mhm.
So when we looked at
How
the
so?
chronic, so depending on when things actually do become available. So for example, with the chronic disease data, the earliest, well, I shouldn't say earliest, but the most recent year for that set of data, right, is actually 2017. And so I went back to the data source to check to see if it had been updated yet, if there was any new information, and it's not, there's no new data yet. So so like 2019, it really depends on the source. So if, this is coming from, say, a federal source, maybe it'll come out a little bit more quickly. So yeah, it really depends on where the data is coming from, and who's, putting it out, who's making it available, and what that timing looks like. But for the most part, we really try to make sure that anything that we have is as current as we can find or get our hands on.
Right.
And I'll also say this too. There are some entities or agencies where they maybe sometimes can be, let's say, not as forthcoming with the data that they are supposed to make public. And so this is also another reason to have this tool so that communities can go back to those entities to say, hey, do you have this available yet? We're, we would like to see it, and to really start to actually empower ourselves to go after the information that we want, because we can be receivers, but we also can be go-getters too. So
really, we're allowed?
We are allowed. I'm giving everyone permission from this day forward.
All right.
If you need it, you got it. So yeah, so this is just really, exciting to be able to look at all these different ways to kind of view our communities, and what's going on. So again, this is just a very general, setup to just get us started and to introduce this tool. And I should say reintroduce this tool, in a new way to our community, get some engagement, get some feedback, and begin to really build it out. And so we'll definitely be working on it a little bit more over the next couple weeks, because we will be doing an official open house launch of the Data Hub event, which is going to be super exciting, where others who aren't able to catch this event can come out, see it again, ask questions, and just really dialogue about this tool, and what it can do for them. And so there will be some more updates too. So it'll be in beta for a little bit, until
which is actually good.
Yeah.
Yeah, because it's like once, if you're allowed this tool to breathe and mature, we can get more and more robust, and then it also costs less. Hey,
yes,
it's my tax money too.
Absolutely. Absolutely. So everyone, in effect, it's like you have a right to get access to the information that you want to have, because we're all contributing to it. So that's a really great point. Yeah. So this, because I know people may have questions like, well, where is this type of information? What is that type of information? And that's the other reason too, that I think having training sessions and like just more community conversation around these areas as well. So when we think about education, there's these other sides of education where, we all know that we often don't really sit on the best side of it as it relates to like suspensions, expulsions, and just, levels of punishment that our kids, are exposed to. And so these are just the different other pieces of information where, you know, we can talk about, is that something we want to have? You know, how much of a focus should we have on that? You know, or should the focus be like, we can look at that stuff, we can say, okay, these are the suspension rates, okay, we understand, but then look at some of the other more community-based asset approaches to the data to say, okay, so then if we're seeing high suspensions, what do our mentoring programs look like? Where are they? How many do we have?
Right.
You know, after school tutoring resources, da 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 da. Like we can kind of go through the litany of the different types of tools that are available to just kind of look and see, all right, maybe is that a lack of having an impact on that particular aspect that's impacting our kids' ability to get a proper education, you know?
True. I mean, sometimes it's environmental. Sometimes
Yeah.
it can be any number of things, you know, and if no one's looking at the numbers, if no one is regarding the data, no questions can be asked and no solutions can be made.
Exactly. And so this is like great conversation to have, because and my hope honestly with this is that it will spark some people to say, well, you know what, I know a lot about, you know, say Black history or, you know, Black enrichment. And maybe that might be a program that someone can start that could be mapped as a resource that would actually help to encourage, or I would say wrap around, like give kids more support around getting the kind of education they need, or supplementing, right? Adding to, enhancing their education, right? Because the more we know about ourselves, the more confident and successful we'll be. And we can map those things too, because that's important for people to know that those things are available to us. And also that if we see areas that aren't touched, we can create those. We don't have to wait for anybody. At least that's my mantra. We don't have to wait. You know, we can start tonight, you know, to start thinking about, okay, well, if we see needs in the data as the numbers relate and show us based on what we have, where can we fill in those gaps? What can we fill those gaps in with?
I think that means that for sure this tool has to have, this data hub has to have some type of way to contact. I mean, it's like, how often are you guys reading the messages that come in from it? It's like, I see something that bothers me, I see something that I want to find out more information about.
Yeah.
Where in this data hub do I connect with someone about that?
That's a really great question. And so as we refine the landing page, I feel like that would be a good place to put our contact information so that people can reach out to us. And we have like our social media pages too, you know, and so any particular source, I think, I'm like bringing the questions in and, you know, and if we need to set up conversations around them, because you may think, oh, if I ask this question, I might be the only one, but you might not, because then it could be a group of 5, 10, or 15 people who actually have the same question. And then we can really dig into that conversation. So we're definitely going to make sure that we have like contact info available and that is prevalent so that people can feel comfortable reaching out, because that's
excellent.
key.
All right.
Yeah, so that will be forthcoming. Okay, so let's pop to our last one. So population, the population dashboard. Oh, this one, it's dear to my heart because it's a little sparse, but here we go. So engine that could of the dashboards right now.
I don't know which one to look
you
at first, that pie chart or the map.
Yeah, it's like, which way do you go? And you can also see here, let me see really quick, that we have a side panel. And so we're going to work on adding other side panels, which is contextual information to just kind of help give people an idea of what they're looking at. So yeah, so then we have the pie chart, and this, like I said, very basic information, total population by race and ethnicity throughout the state of New Mexico. So that's what we're highlighting here in the pie chart. And based on the information we have, our number is at 1.8%. And I was surprised by the number. Other people were surprised. And so I was like, okay, I'm gonna, ask more about it just to make sure that we have the most accurate information, because it feels very low to me. But I don't know if maybe that's just where we are, since we've talked about population from before, with folks moving out of the state and different things of that nature. And, and the circle of life, we're just like that,
Yeah, and so these are 2020 census data, 1.8%, or this is another source of data?
That's a good question. So I wasn't the person who actually created this map. Well, let's see if we can tell what year. Because I don't see the year, although I think this might be 2019 or 2020, because I do believe it came from the census. But that's something I can definitely double check. And that's the other thing too, because going back through, these different ways that we show the data, right? I love getting the feedback of those questions, because I take certain things for granted, that, oh, well, this is the most current, but it's always good to go back and just double check that.
Okay.
Yeah, so I don't see the
source
here. Yeah, but it's the census tract. So my best assumption or best answer to that, these are all based on census tracts, and that it came from census data.
Okay, so again, another reason to have a way to contact you if we want to challenge something, to say, hey, but I thought, that's the whole thing, because sometimes it's hard to remember that, a lot of agencies are willing to show updated information, just may not be aware of it sometimes. Sometimes the data sources can be improved, but this is really, my interest was how, because I also check out with part of my job, HRSA's list. HRSA is a federal agency that talks about clinical services and medical services. And I would be able to go back to this population piece, look at some of the services that are available, and see, so if I look at population, I look at what's available, dental clinics, health clinics, and then I go back to that same area, and I can look at that chronic disease area. I can cross-reference a whole lot of that. And if I then cross-reference it even further, I can see what type of outreach information is available on dental health in Cibola County, because it looks as though there's a high rate of Black people living in census tract so and so and so and so. Is it water? Is it life? Or is it just access to services and care?
Yes.
This is how someone like me wants to be engaged with tools and information like that. This is why I'm so happy. This is why you see I've been yelling, asking around, where is it, y'all? Where is it?
Yes, and it's back. And so, with, I think, just a reinvigorated spirit about it as well. And so I'm excited when other people are excited about it, because, that can help us make it better, and also more engaging, and like you said, being able to kind of dig through on your own and, overlay different pieces of information and to start to do your own kind of analysis is key. And that's what this information is available for folks who want to do that, or folks who just, maybe just want to see what kind of stuff is happening in their neighborhood, or maybe a neighborhood they're thinking about moving into, and they want to kind of get a little bit of a feel for what's going on over there in deciding, okay, is this going to be a good place for me and or my family? So, yeah. So this is the end of this one, but one thing I will add, so in terms of so from population to demographics, so we're going to be looking at adding other things that could help identify, or I guess add a little bit more robustness to demographics. So there may be pieces of information like life expectancy or some other different kinds of information that'll kind of be gathered here. So that's still, like I said, more conversation to have around what makes sense, in terms of what should go where and what things people want to see. So, so if you don't have any other questions about the hub, Jay, I will stop share.
I will let other people ask a question. I think I've done enough.
This has been great, though. Thank you so much. So I will stop share, and I'm gonna kick it over to Devin.
Yes, and thank you both for the amazing, very robust, and very informative conversation. I just got lost in thought just listening to the different points that you both are making, the questions that you're asking, Jay. And so I really appreciate both of you taking the time to, again, talk about the Data Hub and give your expertise on data and informing us all. And so I'm very appreciative. I'm sure the people that are listening in the audience are appreciative. And I was looking for the Q&A and I didn't see any other questions, but just to wrap up,
we covered.
Y'all did an amazing job covering everything.
Thank you. I'm glad.
Thanks.
Every question I had, y'all answered, and y'all even asking and answering questions that I didn't even think about. And so,
awesome.
It's been really great. And before we end the event, I just wanted to let everybody know that we're going to have the official launch of the Data Hub, doing a Data Hub open house on April 15th. And we'll make sure that we get the information to everybody, not only in the chat, but also, or in the event, but also we'll have it on all of our social media. We'll have it on our website. So we'll keep you all posted on that. We're also, as Cynthia mentioned earlier, we're going to be doing training modules. And so Cynthia is working on developing the curriculum, and we'll be launching that later this month. Just so, again, if you want to learn more about how to navigate and access the Data Hub, you can do that. And we also have micro learnings online on our YouTube, which is posted in the chat. And so if you want to learn a little bit more about some of the hands-on things with the Data Hub, you can go to our YouTube and view that video. And then again, all of our social media has been posted in the chat. So like, follow, subscribe to all of our social media channels.
All of them.
All of them.
We'd love to see you.
Great.
From you.
And again, I want to thank you, Cynthia, and I want to thank you, Jay, for both taking the time out of your day to join us for this event. I also want to thank all the participants for taking the time out of their days to join us and provide feedback and give information. So we really appreciate all the time that everybody spent. We look forward to seeing you at other events.
Definitely. Thank you, everyone. Thank you, Jay.
Thank you, everyone. Thanks.
Oh, OAAA.
Thank you.
That's right, OAAA. Okay, take care, everyone.
Thank you. Take care. Night.
Good night.